So if a patient goes to you and they are currently wearing a denture, what are their options when it comes to dental implants in your practice?
Well, first you look at the most basic option, the denture, couple implants, it snaps in, snaps out. That's where a lot of dentists start out. I don't like to do them. I think
you don't like the snap in, snap out.
Patients don't like them. You know, they're told that's their only option. You know, and then the next option is like unto it. You know, you talk about 4 implants, snap in, snap out. Again, same thing. They have to go back and switch out those snaps every couple years, and it feels bulky like a denture. So it's basically, it walks, talks, and quacks like a denture. It's
still a denture.
Just still a denture. It still has the same bulk as a denture. It provides a little bit of support, but we're still talking about mobility. We're still talking, it still gives, if you chew on the front instead of the back, it'll pop out a lot of times because it's like a teeter-totter. So it's not fully fixed, okay? And then that third option, as we talked about, is 4 implants or more, you know, with a fixed implant bridge. So we're talking about fixed teeth on top.
So a full arch of teeth supported by 4 or 5
full
implants.
Full arch teeth, back and front, no movement, no mobility whatsoever. It's totally solid.
They can eat whatever they want?
Whatever they want. We're talking, you know, nuts, you know, broccoli, raw broccoli, you know, salads with cucumbers, you know, steak. You know, some people haven't been able to chew steak for years. So we're talking about, you know, I've had people come and say, you know, the food has come alive for me. You know, I haven't been able to chew and taste food for 20, 30 years, you know, because they've been in dentures for all that time.
Now the upper denture, isn't that pretty good though because of the suction?
Well, that's the thing. It provides a suction. It's a catch-22. That part gives it some just retention, but it's still moving. But when we're able to do it with implants and put that bridge on there, you know, you think about you know, something fixed and that whole palate is removed. That's where there's a lot of taste buds we've found on the palate. So we're able to taste, you know, you're able to feel temperature to food, texture, all that comes alive again. So that's a huge difference for the patient.
Now, how old can you be to get this procedure?
You know, again, there's no respecter of persons when it comes to the need for this. We've done this from people in their 20s, and we're talking low 20s, all the way into their 90s.
A 90-year-old can do this?
Yes.
Get a brand new full set of teeth that don't come out. They can eat whatever they want?
Brand new full set of teeth, whatever they want. And that's the reason they chew. We get the question all the time, well, aren't they, they're almost, you know, they're 90 years old. They're pushing, you know, they're pushing the end of their life here. But so why do they want it? And we talk to patients about this. And even after they go through it, we ask them, and they say, I can chew now. I can eat food. And so we want the quality of life for that patient to be good and to be the best it can be.
Seems very painful.
Well, you think about it, during the procedure, they're numb, they're sedated.
Okay.
So a lot of patients, they don't remember a thing during the whole procedure. And then afterward, we don't have, you know, with the denture, if they remember that when they had their dentures, it was rubbing on their gums, you don't have that. With this, it's fully supported by the implants. So a lot of patients report no pain afterward. Very little.
And they could just take like a, what do you give them, like a Motrin or Advil? I don't know what they take.
Motrin and Tylenol combined have a synergistic effect. Those help. We also do other medications at
So if they need a pain med, you can give that.
We can give them that too. Yeah.
And in the sedation, you're what, monitoring what, blood pressure?
Everything, yeah. Blood pressure, we're monitoring their oxygen, their CO2, so we get to see exactly how much they're inhaling and exhaling. And so we're at a level of sedation that's very safe here. You know, we're talking about they're breathing on their own, they're able to cough on their own, they're able to do all those things all on their own. So we're not taking them into that unsafe realm where it's staying far away from that.